Okay, I think we're live. So, hello everybody, hello everyone. We are really delighted to see you all today with us connected on for this third annual Swiss Accelerators Showcase with a new and improved virtual 3D platform. You should have noticed that to help us to immerse ourselves and connect with all the startups today that we have today.
The Swiss Accelerators Showcase is a virtual immersive event that unites over 30 startups with 5 different startup accelerators and incubators. Today we aim to showcase the cutting-edge technological solutions for industrial challenges, bridge up startups with potential customers and investors, and bring talents.
So today we have we are pleased to team up different incubators across Switzerland together. So we have the pleasure to get Laforge, the incubator from EPFL Innovation Park, the Tech for EVA Femtech Accelerator, Tech for Trust, the Trust Acceleration Program, and also the Future of Health Grant, digital health grant support, and also Fongit from Geneva. They are here to showcase the rising stars of the Swiss innovation ecosystem across different sectors, like, of course, digital health, but also ICT, engineering, clean tech, and much more. There are technologies that can really make an impact and can inspire you today to join and launch your startup later on. So today we also provide you with this platform the opportunities to get one-to-one meetings with the founders. So don't hesitate to dialogue with them, go to the booth, visit them. In order to do so, you can just visit the booth and then click on enter Vizium room, and then a pop-up will appear with like a Zoom or a Teams with the startup founder. So don't hesitate to do that, and you can also, if you wish, book a meeting, so you have like a one-to-one private chat for after this morning event.
We're here to celebrate innovative ideas that develop into disruptive and transformative technologies. And many of these ideas actually start at the research lab. And without the grid preservance and ecosystem support, they will actually never be able to see the light of day. And we would not have the chance to benefit from their impact. So one of these unique ecosystems can be actually found at EPFL Innovation Park. EPFL has actually been founded back in 1991, and it now hosts over 200 companies, of which 150 are startups, 26 are corporates, and over 2,500 people who are entrepreneurs and scientists. EPFL Innovation Park is also home to federal entrepreneurship training and coaching of Western Switzerland programs, and runs various acceleration programs and expert workshop series. These are some of the startups that have been raised in the past 2 years. You can see that some of them are very well known, not only across Switzerland, but also worldwide. And in terms of InnoSwiss, which is a Swiss innovation agency programs, there is a lot of support that exists for entrepreneurs, and there is a lot of support that exists for people who would like to find their company. Starting off with Module 1, which is an event like today where we will be able to welcome 2 speakers and learn from them, ask them questions in a very interactive way. Module 2 would be business concept training that would help you start off your idea and bring it to the market. It would be a semester of evening classes and, for members of Swiss universities and researchers and developers, but also for someone who would like to make a career change and who would like to make a switch. If you like to continue your training, if you like to make your startup go even bigger, you can then jumpstart your ideas and grow your business with modules 3 and 4. So what is business concept training? It has been running for over the past 7 years in 6 cities in Western Switzerland, and has been home to over 1,500 alumni, with 50 mentors and trainers and participants from various universities and research facilities such as EPFL, EHL, HEC, and many more. It is supported by InnoSwiss, it is supported by the Swiss Innovation Agency, and it allows you to not only improve your business and shape your idea, get a lot of research done, but also compose a team meet entrepreneurs, and get an InnoSwiss certificate at the end of your training. So if you would like to join, there is a semester running twice a year. The next one is starting next spring, and it's focused on bringing your ideas to the market. It runs in the evening, and it's completely free of charge. There's a lot of support. There's a lot of support from the mentors and from the professors. And it runs once a week during the 3 months. If you have any more questions, you can always reach out to us, or you can find more information about InnoSwiss and about business concept training on sciencetomarket.ch.
Regarding the Q&A, we will now have 2 speakers who with us today. We are very honored to have them. They became entrepreneurs, and they are in the journey of scaling their science-based companies. So if you would like to ask any questions, just below the platform you have a Slido plugin. Don't hesitate to interact here. We will try to take as many questions from here later on for the Q&A with the startups.
Yeah, so we would like to welcome our first speaker, Andreas from Safetor. Thank you.
Hello, thank you, Katie. Hello, I'm Andreas. I'd like to first thank the organizers for having me here. And by way of introduction, I would say I grew up in Greece, and then I moved to the UK to attend a degree in software engineering at Imperial College London. And then I was recruited in the finance industry, as a lot of people were at the time. So I pursued a career in finance for a bit more than 15 years in a number of roles. And towards the end of that career, I set my sights on life sciences because I thought it was a fascinating field, and with plenty of problems to solve. And as an engineer and a kind of geek myself, I like hard problems to solve. So I took the opportunity that presented itself as the global financial crisis in 2008 to actually switch to life sciences. And I came here and joined a research lab at the EPFL, at the Institute of Bioengineering, to conduct research in genetics that led to a PhD. So during that research, I came into contact with DNA sequencing, or the technology that reads DNA. And that technology was revolutionary, and I quickly realized that the technology was maturing, and at the same time it was scalable, and the price was coming off. It would continue to come down for a while, for a time to come. And also, it had a wide range of applications in human health. So I reached the conclusion that this technology the world would need an engineering solution to make the most out of this technology, as it also produced copious amounts of data that had to be made sense of. And so it's a large-scale engineering challenge. So if this was the 19th century, people like me would be working on railway networks and building tunnels and bridges. But in this time, this is, I believe, the largest engineering challenge of our time, putting together molecular data and making the most out of it. So to that end, I founded Safetor after I finished my PhD. So Safetor's mission is to enable anyone to find, share, and use the most comprehensive human genome data and to collaborate to improve health and lives around the world. So we take our missions very seriously, and the emphasis here is given in the word data. We are a data company. It's all about scaling the use of data. And also to the word collaborate, because we enable collaboration, which is crucial in, again, taking the most value out of this data for the benefit of human health. To take things from the beginning, you may know that our genome is made out of DNA, and it's a 4-letter alphabet, and we each inherit 3 billion letters, a sequence of 3 billion letters from our mother, and another 3 billion letters from our father. So we have 6 billion letters of sequence in our DNA. And if you compare any two people, 99.9% of that sequence will be the same, but the 0.1% that differs still accounts for about 5 to 6 million differences, which we call variants. So if you compare any two people, they will have 5 million variants relative to each other. And so if you then think that we are now reading the DNA of millions and millions of people every year, you quickly get to the realization that the amount of data produced is absolutely staggering. And also, most of these variants that everyone has are actually, they either don't do anything, or they account for the natural differences between any two people, right? We're all different, and DNA has to do with that. But very few variants could make a person sick. And so we need to identify which ones they are. So we have to mine through vast amounts of data to figure out what makes people sick, and it's different for everyone, possibly. So, and as I mentioned also, there is a wide range of application in medicine. So for example, cancer. Cancer is a disease of the genome. In 100% of cancers, there is something that goes wrong. There is a variant or two that triggers cancer, and they make people sick. Same thing for rare diseases. Although each of them is rare, there's 7,000 of them. So collectively, they affect 7% of the population in most countries. And there are some more common diseases, such as diabetes or epilepsy, that are also found to have a genetic component. So there is a very wide application in this field. And so what we have done is we have first built our own technology to integrate, store, and retrieve data extremely efficiently. And we built that technology from scratch as an engineering company. And then we built a number of platforms, automated platforms, to make the best use of this resource, which is data and algorithms that interpret that data. So we built a number of platforms for a number of use cases. Our best-known platform is Varsam.com, which was launched in 2016, and it was immediately widely adopted by the global professional community. And Varsam is a search engine, as well as a community of geneticists, human geneticists across the world. And it has steadily grown and now reached more than 500,000 of professional users in pretty much every country. And our platforms collectively have been cited in almost 2,500 medical publications. So Varsam, apart from being a search engine, as I said, is a community, and this is an example of its use. So you have here a doctor from Iran and a doctor from the United States discussing a patient case on Varsam. And these two doctors will contribute better to the outcome of their respective patients by exchanging this information. Because if you consider that the variants that cause disease are quite rare, and the chances that a doctor will see a patient with two patients with the same variant in their career are very small. So only by this international collaboration can we hope to make the most out of genomic data. And as a result, Varsam creates a large network effect. So people go to this platform to see what their colleagues think about a particular genomic variant that they were looking at the patient. It's not just for research. It's mostly used for diagnostic purposes. And so we have created the largest network of collaborating professionals in this field in the world. And to close, I would like to offer some personal insights from my journey as an entrepreneur. So the first thing is that to start a company, it's important to be solving a problem, and it's important, the bigger the problem you're solving, the better, of course. But it's also important to do it at the right time. So it's important that the people you're solving the problem for know that they need a solution, and they accept that they need a solution. Because you could be solving a problem at the wrong time, and that, like, from my personal experience, in hindsight, and of course hindsight is perfect, it would have been better to have started Safetor perhaps a year later, because in the beginning it was a bit slow. So I knew there was a problem, and a large one, that we were solving, but some of the people we talked to didn't realize that. Now, of course, a year in the grander scheme of things is not that much, but it's important to know that you're solving the right problem at the right time. Another important thing that, as you probably already know, is to be tenacious and persistent, and I cannot stress that enough. All entrepreneurs, they don't get what they want on most days. On most days, you will not have the outcome you're looking for. So it's really important to be focused on your mission. Even the most successful entrepreneurs, no matter how you define success, will not get what they want on most days. So it's really important to have the ability to stay focused. And for that purpose, it's important to have a stable personal life, to have a supporting family and friends. And I've been blessed myself to have a very supporting life partner and family to help me with this journey. Another aspect is that your job will change will change all the time. So if you're managing a small company, your title may not change, but what you do every day will change, and it will evolve dramatically. A company is a bit like a child, right? So a 2-year-old is different from a 6-year-old, which is different from a 10-year-old. The same thing happens with 2 companies. So Safetor is now an 8-year-old company. We have 60 people, and we are growing mostly organically. We have raised a relatively small amount of capital, and we have paying customers in 50 countries in the world. And out of the 60 people we have today, 27 have started this year, and we have similar plans to continue expanding for the foreseeable future. And I found that my job has changed dramatically from the beginning, and there's no point where I could say, I put my feet up and say, now I've proven myself, and I don't need to work hard anymore. You have to prove yourself every day, again and again. So it's very important. And last but not least is the factor of luck. Luck plays a very large role, and more than we are prepared to naturally admit. And I'm considering myself a very lucky person. And luck, of course, is something that you don't control by definition. But if you solve the right problem at the right time, if you have a stable personal life, if you're prepared to prove yourself every day, and if you hang in there and stay focused on your mission, you will get lucky sooner or later. Thank you very much.
Thank you. Thank you so much for sharing this with us. This was really insightful. Before we go to our second speaker, I would just like to remind you that if you'd like to ask your questions, we will take them after both presentations. You can ask your questions in Slido, and also upvote the ones that you find the most interesting. And now I would like to welcome our second speaker, Thomas from Vizium.
Hi, everyone. Hi. Thank you.
Thanks.
Hi, everyone. And also, I want to thank everyone here for inviting me here, and just tell you a bit about myself and my journey at Vizium. So first thing first, Vizium, in a few words, Vizium was founded in 2018 because we saw that with the rise of ML and AI, there was really a need from all those different companies that wanted to digitalize themselves and become data-centric. But they really didn't have neither the expertise or the team to actually do it, and that's where really Vizium came in. It was born really to help those companies leverage their data using AI. And so our goal is really to become one of the leading AI providers in Europe and in the world by focusing on responsible and ethical ML solutions. But me, I don't really founded Vizium. I joined it basically as an intern. So I was doing a business degree here in Lausanne at the time, and I was looking really for an internship for my studies. And I don't really remember how I found Vizium, but I think I found it on the internet. So talk from Alan with the founding team. So you have here Alan Arslanajik, Timon Zimmerman, and Matteo Togniniali, who so created the company in 2018. And so me, when I found it, I knew from the start that it was really the company that I wanted to join. So when all my friends were really doing motivation letter after motivation letter, applying to 10, 20 different internships to find the right one, me, I only wanted that one. I knew it was really the startup that I wanted to join. It was a tech startup. It was focusing on AML with a really young team of bright and motivated people. And so I only applied for that. So it was either I got the job or I was like, okay, I'm not really sure I'm going to pass my studies. But luckily, I got in. And so it was really the beginning of the company, so it was not a lot of people. There was only 4 or 5 people at the time. So when I joined as an intern, it was this really big idea of Vizium. You have this 10, 20 long-term plan that you want to build. You have this mission, this statement, but just a wonderful big idea, but everything to build. So it was really the dream job. You have so much to do, absolutely no way on how to do it, and so you just have to be with this team and work your every day really to try to solve all those problems one by one. And so it was really that for 6 months, living the dream, trying to do everything, working a lot, and then back to reality after 6 months, I realized that I'm still a student. I still need to get that degree to finish this. And so I was like, okay, I love Vizium, but I still need that, so what I'm gonna do? And so I went back to my studies, and for the remaining year of my studies, I basically worked 100% for Vizium, 100% for my studies. And this was really kind of challenging and exhausting. I also wanted to join the business concept at the time, but with Vizium and the company, it was kind of difficult to do it. And so with the team and with a lot of hard work, a lot of success, a lot of failures, I basically did that for the year and only had in mind to join them back fully on time. And during this year, in 2019, it was really when everything started to grow up. So when I joined, we were really just 5 people, but during the summer, we were able to sign really a 12-month roadmap with the client. So it was really some kind of relief, because for the first time you see that a company is really putting a lot of money on the table and really trusting you. They're trying to buy a solution that is not built yet, but it's really trusting you, and you see that all the work that you've been giving in is rewarded, and that people trust in you, and it's really some relief. And as well, because, I mean, for the first time, we knew we had enough money to pay the salary for quite a lot of people for the foreseeable future. So that allows you to plan a little longer ahead, and it's really great. So we got bigger offices, start paying salaries, hired other people than interns, basically me. And by the end of the year, we grew our revenue by more than 900%. And from a team of 5, we were 25 at the end. So it was really growing, and everything was perfect. And since then, we've been trying to grow as well. Now we are more than 50 people in 3 different countries in Europe, fully bootstrapped, so no investment at all. And we have even more exciting and more challenging targets for next year. But of course, not everything went according to plan. And so I wanted to share with you one of the failures that we had. So if we go back to the vision of Vizium, is to, by providing those ML consulting services for those different companies working with different clients in different industry, different markets, we wanted to be able to gather as much insight, as much knowledge from all those different stakeholders, and to be able to identify one idea that we could productize. So instead of doing services, to create a product from it that will be much, to be able to sell to a much wider market, to be much more scalable and profitable. And so in 2020, we did this project for a client that was really successful. We did that in 3-4 months, I don't remember, and we generated really a lot of value for this specific client. And so we saw that it was working really great. We really had that need, that will to do a product, and so we looked a bit on the internet, we did market research, we did everything, and we found that there was not much competition, there was not really anything to do. We know that it was feasibly technical to do it, and so we went fully into it. And so for 8-9 months, we created that, we developed that solution, and we started doing that. At the time, we had like 5 or 6 full-time engineers working on it, marketers, product owner, and everything. And after 8-9 months, we really needed to get some money out of it, to start selling it. And so we were talking to all those different people. But we couldn't really find anyone who was willing to pay for it. And so we had to take a step back and really think again about the solution, about what we wanted to do. And so we couldn't really understand, because we generated so much value for this person, and we had a working product. But we realized that during those 8-9 months, when we were talking to those investors, to those clients, to all those different people, they were interested into it, but they were not really willing to pay for it, because as it was said previously, you can have something absolutely great, but if there is no need for it, if there is no market for it, then you can basically do nothing with it. And so we had to take the hard decision to stop the development of the solution and to think about it. But after investing almost $1 million into it, we wanted to gather as much knowledge, as much value from what we did. So we really had to do that post-mortem analysis of the project and to understand, okay, what we did wrong, what we did well, to ensure that we learn as much as we can from it. And so in the future, if we start again, if we do something else, we can learn from those mistakes and make sure that it's not going to happen anymore. And that's basically what we did. And also we took the decision to focus on what we do best, which is 2D ML consulting. And that's, I think, really important. And what I wanted to share with you today is really whether if you're a founder or if you are joining really a small company as an early employee, please know that building a company is a mess. You don't really know what's going to happen, when it's going to happen, and you just must be prepared to absolutely everything. You must never give up. Be persistent, be resourceful, talk to as many people as you can. Google is your best friend. Try to learn from the mistake of you, from others, and really, if you never give up, basically you never fail, because you keep trying. Surround yourself with a trusted team so you can lean on with them. You can share the excitement, the fear, the joy of failing, of succeeding, and it's really what's going to motivate you in the long term. Practice as well, iterate as well. I mean, you're going to have a lot of failure, a lot of success. Learn from those. And most importantly, as far as you know, we don't really know how long we're going to be staying in this earth. So try to find something that is meaningful to you, that you love, and that you have fun doing. And if you find that, and if you do that, I mean, you can go absolutely anywhere. That's it for me.
Thank you so much. Thank you so much for sharing. We will now invite both of our speakers for a question and answer session.
I think there is a few delay between the live and the YouTube, so don't hesitate to ask your questions on Slido right now. We'll try to take them and ask them to our speakers today, so don't hesitate to do it. Just below the plugin of the virtual event, there is the Slido plugin also attached here. Like
so if you don't have the questions from the audience just yet, I think my first immediate questions would be to you, Thomas. So as you said, you joined the team when it was still very, very fresh, when it was still very young, and they weren't even paying the salaries. Why did you decide to join, and how did they motivate you to do that?
I mean, it was really, I guess, the excitement of trying to build something and to find this team of people that was really motivated, that were really motivated to build something. Me, I've always been interested in the tech industry. I wanted to join a startup, to do something. I must say I'm not really a founder, but I really wanted to be part of an adventure like that. And so there was not much salary, but just the joy to be able to create something and to see the direct impact of what you're trying to do is really something that is, I think, meaningful. And yeah, that's what I'm motivated to continue working for them, with them.
Maybe a question for you, Andreas. As you mentioned a lot, Thomas, about your team. How did you meet your co-founders, and how did you started this whole journey with the team? How did you find them also at the beginning?
Yeah, so I started the company by myself, as I mentioned, because I saw this opportunity. And the team was, I found through the network, the initial colleagues, but we started very small. So since we need to establish some milestones like every company before we commit to a much bigger team and with a much bigger cost. So we need to make sure that we have a reasonable demand for what we're making. So, and as I said in the beginning, it was a bit slow. So we grew initially very slowly. So in the first 2 years, we were 5 people at most. So, yeah. Then.
And regarding the market that you mentioned, you realized that there is a market quite early. How did you realize that? Did you make some studies, or did you get attraction very early on?
Right. I was talking to people who were looking at the DNA data, and this is how I thought. And we were lucky enough to be in the region where there's a lot of advanced research, and research hospitals are moving on to applying this research to their patient healthcare. And we had some early customers, so the first customer signed up a year after I launched Safetor. And one thing led to another, and we started growing.
Okay.
If we're speaking about growth, I think it would be a question for both of you, because you are now present in over 150 countries, right? And then for Vizium, it's around 50 countries all over the world. What would you say were the challenges in that process of scaling up and dealing with different countries, different partners, different developers from all over the world?
I think it's important to also recruit, as members of our team, people from different countries to bring different perspective. So our team of 60 currently is in 10 different countries, and we are expanding. We're about to hire the first employee in Latin America. So they bring different perspective, and they can bring different cultures and the languages, of course, matter. And so that was our approach, is to basically engage with an expanded team globally while we're also expanding our customer base.
And for you?
Yeah, I think it's really important to find different people from different culture, different region, because, I mean, at least for our business, relationships are really key. And so having those diverse backgrounds from different people that know different industry, different clients, potential clients, it can be really helpful. So if you want to expand in the US, or if you want to expand in Germany, I don't know, maybe try to find someone who actually knows the market, who's going to allow you to accelerate your penetration of this new market.
Yeah, for sure.
A question also from the chat for you, Andreas. How did you get you were created in 2014, right? And at this time, the support ecosystem was much smaller than it is now. And how did you get the funding and the first funding steps until the first customers and clients?
Yeah, right. So as I said in the beginning, we didn't need a lot of funding because it started very small, and it was partly self-funded, and also we raised a small round from friends and family at the end of 2015, so to build our first products.
Okay.
For Thomas?
There is plenty of questions in the chat. Don't hesitate to upvote or also downvote the best questions. There is a question to Vizium, to you, Thomas. What impact do you expect machine learning to have on the energy sector?
Well, so me, I'm more on the business side, to be totally honest with you. So I'm not an engineer, unfortunately. I think it's gonna help a lot. I mean, with the energy utilization and the energy management for everything, energy is flowing from absolutely all the different countries, and trying to analyze how to optimize all the different routes to make this energy flow between all the different stakeholders can be really helped with AI and ML.
Mm-hmm. Checking also the questions. Does your product needs medical certification? I guess it's for you.
Yes, it's a great question. It does, and increasingly so. So we started in an unregulated industry, but for very good reasons. We are now increasingly regulated because, of course, the aim is to protect patients' health. And as we're evolving as a company, we need to spend more and more resources in compliance. And so, yes, our products are certified, and increasingly so, yes.
There are questions also on to both. Would you retire from a current startup, or would you like to build another one? Like, are you an entrepreneur like by heart, or are you stick to your project mainly?
I think I don't see myself leaving Vizium really for the foreseeable future. Okay. And once you get used to startup and really this ecosystem and this environment, I don't think I would like to go work for a big traditional company. Yeah, okay. So build my own in the future maybe, that's for sure.
And you, Andreas, how do you see yourself?
Yeah, I haven't thought about it actually. I think, for the foreseeable future, of course, I'm committed to continuing the growth path of Safetor. Mm-hmm. If that comes to an end at some point, I will then have to think what happens next.
Mm. And if we are speaking about the future, I think my question would be about the vision for the company. It's a little bit of an interview question. So where do you see the company, let's say in 5 years, how do you see it moving forward? I think you said that you're expanding to Latin America. Do you have any more greater plans that you would like to share with us?
Yeah, well, we are in a path of exponential growth, and we have been, and this can be, continuously repeating itself, and it's to continue. Let's say if you're doubling or tripling every year, it takes doing different things to continue on this doubling and tripling. But in the end, the vision is to help the largest number of patients possible, and we're growing with the industry, and the industry itself is growing at an exponential pace. We're growing even faster than that. And I think it sounds maybe boring and repetitive, but that's, in the end, the aim is to build the presence and to scale up the use of genetic testing in healthcare.
Yeah, thank you.
I think so. We, of course, have a long-term plan in the end, but what we want to do first is really try to expand a bit in different markets, and also the main goal of Vizium is to become one of the leading AI providers, because we really have at Earth to have a positive impact on the world, to be responsible, ethical. And so right now at the beginning, we don't really have much money, we don't really have a lot of projects, so we must kind of accept what we can, with still, of course, this line, this frontier of not going too far from it and only accepting nice projects. But so I hope that in 5-10 years we would have grown massively and be able really to focus on those really positive projects that are really going to help the society at large.
Yeah. Can you foresee any challenges on the market or any problems that you may encounter? I mean, it's difficult to foresee the future, but maybe do you see already some trends in terms of what you're doing?
Of what?
Do you maybe see some trends in the industry that would make it more challenging for you to continue growing?
I guess with all the different regulation about AI and data, that could be maybe a bottleneck in the future. I don't think it's going to impact us really in the near futures, but that's something to continue to look at. I think it's rather the opposite. There is so much data generated, so much technique that are being developed today that in 2 years, I mean, I'm sure the science will go even further and is going to allow us to grow even faster and to help even more people. So, so I rather see the future as an opportunity than a limit.
Thank you.
Yeah, I agree 100%. The challenges we're facing now and see facing in the future are the good kind. It's how to continue to scale up the team and do that smoothly because, again, you know, the team size means that the whole management structure has to evolve and we have to learn from a lot of others of how this is done. And these are the kind of challenges that we are facing now and will probably continue to face. So this is like about how to scale, basically.
Okay. Do you have any advice for students and researchers and people who would like to fund their company on how to scale up better, on how to be a better startup founder?
I think one of the most important things for me is really to find a co-founder. I know you've built it on your own and you've done an incredible job, but having to find another co-founder to actually share your experience and having this second point of view can be extremely helpful. Maybe finding someone who is more on the business side and someone who is more on the technical side. So both of you will bring their own knowledge and experience, and it's going to be the perfect combo, if you can say.
Thank you.
Yeah, I agree. I don't think I have anything to add to that. Yeah.
Thank you.
Okay, let me check again the questions from the audience. Again, there is plenty. We will not be able to take them all, unfortunately. Maybe one last for both of you. That's a question that we often have as a support organization for startups regarding the fundraising. What's the balance between the funds that you need to, the equity that you need to give to the investors and the fact that you need to scale also, so make the funding. So what's the right balance? I guess it depends on the company, but for you, what was the case?
I mean, for us, so we are fully bootstrapped. So we own 100% of the shares. So we don't really have that issue right now. It's, I guess, the best. I mean, there are some issue with it, but it's really what we prefer to do. It's a really tricky question to answer, but I guess the most you can keep at the beginning, the better. Maybe you have a better answer for that.
Yeah, thank you. I believe that this varies obviously with type of companies. So biotech companies give a different answer to technology companies and so forth. And it also depends on market practices and conditions. As we know that in the last couple of years, things have changed dramatically in the expectations of investors, the amount of dilution that they require from companies and so forth. So there's no single answer. It depends on the company's needs for capital and market conditions in general.
I agree, yeah, I definitely agree. So talk to your neighborhood coaches and you will discover what's the best for your company. Thank you very much for this Q&A session and presentation. It was much appreciated. And we will now continue with another part of the program, the most exciting in my opinion, because it's the pitch from the startups. So we have divided the 33 pitches into 3 batches, and the first one who will pitch will be the startups from Future of Health grants, so there are 10 of them. Then we will have the Tech for EVA, so Femtech startups, and Fongit, so also life science, medtech startups. And third, last but not least, we will get the startups from Tech for Trust and Laforge, so the high-tech startups from the ecosystem. So the first startup to pitch is Neuria, and I see Lucas, you're here. Floor is yours when you're ready.
Thank you. I'm very happy to be here. My name is Lucas Pirer, and I'm the CEO of Neuria. We can modify your taste. we found a way to change what you like. This has huge implications. Why? Because what you like determines your consumption behavior, and what you consume determines your health. You like chocolate, you eat too much chocolate, and you develop diabetes. So it's straightforward. By changing what you like, we can improve your health, and on this basis, we can prevent and treat any disorder following from the overconsumption of unhealthy items. How does it work? So we find a way to induce targeted brain plasticity in the reward system by the practice of specific tasks. It's a kind of brain training. Because the reward system determines what you like, our intervention modifies your food intake behaviors. We can induce a 20% reduction in the liking of the target items in 95% of the users. Our claim is so strong that it took me more than 10 years of research to be confident when I tell you it works. We are the first worldwide to propose an evidence-based digital therapeutics to modify the reward system. We deliver our digital medicine via professional-level video games, and this is to improve immersion and compliance. You just enjoy our games, and your preferences change, and so do your food intake, without being even aware of it. Noria is a spin-off of my neuroscience laboratory at the medicine section of the University of Fribourg. We are 5 founders specialized in neuroscience, programming, video games, and arts. And we mainly follow a B2B2C model. We propose our softwares as license pack. Our target market are currently clinical institutes, pharma, and weight management services. We are focusing on our software to be certified as a medical device, and we plan to develop intervention also for tobacco and alcohol overconsumptions. Thank you very much.
Thank you very much, Noria. Thank you, Lucas, for this great pitch. So if you're interested into the startups, gamification, and changing the behavior comportments, then of course visit their booth. Just, go to the platform and check Future of Health Grant, and then you can have a chat with the Noria founders who are here to answer all your questions. So thank you very much, Lucas. Let's move on to the next startup, Mark for Detectra. Mark, whenever you're ready, the floor is yours.
Thanks a lot. So I'm very happy to be here. I'm Mark from Detectra, and I will talk to you about arthritis. So as you may know, arthritis, it's painful, it's disabling, and the disease flares are hard to predict and can happen at any time. They damage the tissues and they worsen the patient conditions. So for rheumatologists, the best strategy is what we call treat to target. So it means regular focus on the monitoring of the disease activity to properly manage the therapy and adjust the medication, aiming for remission or at least stability in the disease activity. The problem is that there is no biomarker available for accurate and specific arthritis monitoring. So today, arthritis patients have to visit their doctors regularly, no matter how they feel, while doctors have to assess the disease activity and the risks of relapsing or developing a flare without efficient tools. So as you can guess, there is room for improving that situation, both for patients and for healthcare professionals. That's what we want to achieve with Detectra, the first biomarker for arthritis. Our patented technology is based on image recognition and machine learning and allows the monitoring of arthritis simply by taking a picture of the hand. The dorsal finger folds on your hand are changed during inflammation or swelling that happen with increased arthritis activity. And that is what we track for the monitoring of disease activity. You can simulate that by pinching the skin of your joints, finger joints, and you see your dorsal finger folds are reduced. We are developing a self-monitoring app for patients so they can easily and regularly monitor their disease activity at home. And on the other side, we aim to provide clinicians with a patient management dashboard to simplify the follow-up of their patients and to facilitate the monitoring of their symptoms, disease activity, or response to treatment, also to warn them when abnormalities or increased flare risks are detected. If you want to know more about the project, I'll be very happy to discuss with you at the virtual booth, Detectra, in the Future of Health Grant part. Thanks a lot.
Thank you very much, Mark, for this pitch. Hopefully I don't have any arthritis, but if you do, I'm pretty sure this app will be very helpful. So even if you don't have arthritis, you can visit their booth if you're interested into their project. Let's move on to the next startup, which is Vitalize DX. So Vitalize, whenever you're ready, the floor is yours.
I'm ready.
Hello.
I'm ready. So sorry, it's not Anne, it's me, it's Carlos. I'm glad to be here and told you the story of John and Elsa. We are in 2027, in the near future, and these two people have one common point. Both of them, in one moment of their life, took the decision to improve their health quality. They have searched and they have found Vitalize Diagnostics, a company that, with a spit of saliva, create a profile for each client, and now each day they take nutraceuticals made for them, and thanks to the regular analysis of their saliva, they can follow the state of the 4 pillars of human health: immunity, metabolism, vitality, and strength. They adapt the nutraceutical by their needs. But this was 3 years ago, and now in 2027, they belong to one of the biggest communities that take care of their health through prevention. And thanks to Vitalize Diagnostic, they can also follow the evolution of their body and keep it in a good shape and adapt the nutraceuticals in case of need. But let's come to today, November 2022. In this moment, this company is more than a simple project. It's a baby that starts to grow up. You want to ask me why? It's simple. We already started to help our clients by proposing them salivary hormone tests that allows them to know and understand their hormone balance and to respond to it through nutraceuticals and or changing their habits. So the future has begun. Will you be part of it like us?
Thank you so much. This is really exciting. Thank you for sharing.
Thank you.
Okay, let's move on to the next pitch from Biped, Maël. Whenever you're ready with your nice set for impaired people, floor is yours.
Sure, thank you very much. So my name is Maël, I'm the co-founder of Biped, and about 1.5 years ago, I met a blind person who was crossing the street while holding his phone, and he was actually doing a FaceTime video to someone in the street to try to avoid obstacles that were on his way. And that's the moment I realized that while I was doing my PhD in machine learning at EPFL, I needed to start building something that had a chance of helping people like this person. I contacted the ophthalmic hospital in Lausanne and started working on Biped. Biped is a smart harness that is worn on the shoulders that has the capabilities of a self-driving car, but at a pedestrian level. Has the ability to detect all sorts of obstacles that are on the way of the user, detects also pedestrians, vehicles that are coming in the way of the user, and warn the person with 3D sound feedback. So it would work just like a parking assist of a car. So if there is an obstacle coming from the left, you'd hear a sequence of bips coming closer and closer to give you the ability to detect things in time. We started this project 1.5 years ago. We now have a team of 6 based in Biopol, recipient also of the Future of Health grant, and I'd be happy to tell you a bit more about our technology and what the next steps are in our virtual corner, biped.ai. Thank you very much.
Thank you so much, Maël.
Thank you so much, Maël. Yeah, very interesting project, and congratulations for the kickoff of your product that will be on the market very soon. Congratulations for that. Yeah, no, I think that's. Let's move on to the next one, which is Okumeda. Can you hear us?
Yes, I can hear you.
Perfect. So whenever you're ready, the floor is yours.
Thank you. Hi, everyone. My name is Benedict, and I'm the CEO of Okumeda. With Okumeda, we revolutionize medical eye care through telemedicine and AI. What problem do we address? Statistically, every 10th person in this room right now suffers from a medical eye disease, an eye disease that might lead to blindness. But the problem is that most of you who might suffer from this do not know about the eye diseases, since they do not visit an ophthalmologist on a regular basis. And typically, once you feel symptoms, the eye disease has already progressed, and you might suffer from irreversible damage. But let's be honest, visiting an ophthalmologist or a doctor in general is an unpleasant experience. It's hard to get an appointment. There's long waiting times. It's typically an analog process, and it's also expensive. You might need to pay by yourself out of pocket. With Ocumeda, we are here to change this. We offer telemedical eye care services at your fingertips in cooperation with partners like opticians. With us, you can simply visit your local optician close by to take an eye exam with Ocumeda. The optician will measure all medical data that we require for our services. These data are then uploaded to the Ocumeda telemedical cloud, where Swiss ophthalmologists will analyze those data and provide you with a result whether everything is okay or whether there's any abnormalities that require treatment. These services by ophthalmologists are supported by state-of-the-art AI solutions that improve the quality of our services. In case you have any issues, we are there to help you to get into treatment. Right now, we are already present in the biggest cities in Switzerland, like Basel, Zug, and Zurich, and we plan to be present all over Switzerland by the end of next year. Are you curious to get to know more about Ocumeda? Then please visit us at the booth today, or just simply check out our website under ocumeda.com. Thank you so much.
Thank you very much. Hopefully we can also have Ocumeda here around the region in the Lausanne area where we are standing right now. Okay, thank you very much. And let's move on to the next startup. Pitching today from the Future of Health grant. And I see that you're ready. So the floor is yours.
Yes,
Ila.
I am. Thank you so much. Hello, everyone. My name is Cordelia. I'm calling from Bern. And together with Florence, we have incorporated ELA back in September this year. So what are we doing at ELA? We aim at rethinking psychotherapy via a blended approach. Maybe you know the blended approach from blended learning. So going to school, learning at home, and being supported in between the live sessions. And also for physiotherapy, you go to your physiotherapist, you do your exercises, ideally at home, and you get better results. So the issue today with psychotherapy is, I assume you all know someone who is suffering from a mental health problem, from an issue, from just not having access to care, waiting for a therapy space, and then going to a therapist, waiting another 2 weeks until it continues. And even inpatient treatment is so inefficient today, at least in some clinics in Switzerland. So what we built is a virtual platform, an interactive psychotherapy platform, where we can support therapists in their sessions, in digitizing their processes, and having tailored and personalized exercises ready for their customers, for their clients, and then connect in between the sessions via this platform. And the patient gets tailored exercises, surveys, motivational tools to continue the psychotherapy in between the sessions. We are a software as a medical device, class 2A, and we will be able to identify patterns based on our future data that we have to further improve and personalize and individualize psychotherapy in Switzerland and beyond. So we are very happy to talk about our mission and our vision, and yeah, to get to know you. And please visit us on our booth. We are happy to talk. Thank you so much.
Thank you. We would now like to welcome the next startup, which is GlucoPlay.
GlucoPlay, so another gamification app, this time for children with diabetes, if I'm right. So GlucoPlay, whenever you're ready, the floor is yours.
Yes, I'm ready. Hello.
Hello.
Hi, everyone. My name is Vera. I'm a co-founder of GlucoPlay. So basically, the idea of GlucoPlay came to me and my husband after 2 years of managing type 1 diabetes of our son. As you might know, type 1 diabetes cannot be cured at the moment. So the patients with type 1 diabetes have to constantly take insulin to manage their glucose level. And for that, we are using different technologies as CGM sensors that are constantly monitoring the glucose level, and insulin pumps that are giving insulin, or insulin pens. The problem is that type 1 diabetes is mostly diagnosed when the children are small and they don't quite understand their diagnosis. If they feel themselves quite good and they don't feel any problems, the situations might be quite risky and dangerous. So for them to educate them most on their diagnosis and what's going on exactly in their bodies and why their sensors are showing this or that, why they should take insulin, why they should calculate the carbohydrates before eating anything, why they can just go out, drink Coca-Cola and eat candies whenever they want. So for all these problems, we are working on a gamified patient experience application, which is called GlucoPlay. And this will be a mixture of both a monitoring medical device, such as applications that we already have on the market, paired with a CGM sensor and probably in the future with an insulin pump, and a gamified unique experience. So throughout the game, which will be based on the data received from the CGM sensor, the kid will realize what he or she should do in this moment and educate himself or herself more on what's going on exactly in his body at this right moment. So the technology of the GlucoPlay will be also qualified as a medical device software, and we are planning to probably pair it with 1 or 2 CGM sensors. We start with our Swiss market and we go on to the European and global market, such as US and maybe Asia. So we have big plans, and now we are ready to start working on the Swiss market quite soon. Our mock-up is almost ready. So this is it.
Thank you very much for the presentation of GlucoPlay. If you're interested, if you're an investor, if you are just interested into the technology, if you have children with diabetes type 1, of course, you can visit their booth and chat with them. They will be here to answer all of your questions, I'm sure. Let's move on to the next pitch, which is Genome. Sebastian, we are a little bit early. Sorry to take you like this, but it's perfect. Whenever you're ready, Sebastian, the floor is yours for the pitch.
No worries, I'm ready. So, hello everybody, good morning. Thank you for your interest. My name is Sebastian Husley, and I'm the co-founder of Genome, the Swiss epigenetic company. Our ambition is to develop epigenetic tests as a gateway to generate demand for preventive care. With this, we aim to disrupt the current curative medicine paradigm towards preventive medicine. We dream of a society in which diseases are detected and prevented before they occur. To do that, we are building a comprehensive health assessment, which will include all lifestyle and environmental impacts on health, along with chronic disease prognostic. Our technology is based on epigenetics, which is the science studying how our genetic reacts to our environment and lifestyle. We can measure on your DNA how your genes are triggered by your lifestyle. For example, we can measure if you smoke and how much this impacts you personally. We currently work with private clinics specialized in prevention and longevity in Switzerland and in Europe. We are looking for partners to increase our reach and develop our product. Please meet me in the virtual booth if you want to know more. Thank you for your attention.
Thank you very much, Sebastian. That's a nice project that we support at the Future Health Grant. Now we have 2 startups left in this batch, which are Consulto and Gosic, and we will go with the first one, Consulto. So Baher or Vizium. If you are
Hi,
allowed.
actually, yes. But for the sake of the presentation to be me. So hi, I'm Bassem, and I'm the co-founder of Consulto. The people we help here are the people who have complex conditions. Most of us know someone has cancer, maybe endometriosis, autoimmune diseases. All of these diseases have one thing in common. They are all complex. They all require more than one doctor. And from I'm a doctor myself and have family members who have been in these positions. And we discovered something, that the healthcare system really fails these people. And what we do in Consulto is that we build a decentralized healthcare system or ecosystem that enables team-based care or interdisciplinary care when you need more than one doctor. The issue is that if you have one complex condition, you end up in a healthcare journey that is extremely inefficient. Well, that's bad in the bigger picture for the healthcare system. But if you think for the patients, it's really a big deal because you end up losing the most important asset, your time. And maybe you don't get diagnosed. Maybe you get misdiagnosed and have the wrong treatment. Maybe you get complications. And all of this in the world where we have all these amazing diagnostics and all this incredible knowledge of our human body is one word, is unacceptable. What we do in Consulto is that we build a system where patients can be surrounded with a team of healthcare professionals that is adapted around their needs, values, and preferences. And this composition of teams and their workflow will change as your needs change, as they grow or as they decrease. And at the end, you have personalized healthcare that is fitting to your needs. Today, the patients need to adapt to the healthcare system. What if tomorrow we're able to have a healthcare system that actually is designed around these patient needs? A healthcare system that not only is good for patients, but also is good for the healthcare system in general by being more efficient and more cost effective. Just this year alone, around the healthcare cost for the premiums increased around 6.5%. It doesn't take a math genius to know that this is unsustainable. Just in 10 years, maybe we'll double that amount. So a big change needs to happen. And we're very happy that Consulto is in a mission to change the healthcare system towards this more personalized and more holistic care. And if you would like to know more, please come and join us in our booth. And we would like to thank all the supporters, on top of which, for sure, the Future of Health Grant, who's bringing us here today. Thanks so much.
Thank you so much. Yeah, I forgot to mention that we'll get a small poll for all the first batch after each batch of the pitches, so you can also vote for the best startup in your opinion. Let's move on to the last but not least pitch of this batch, which is GoSick. So GoSick, are you here with us? We are a little bit early in the program, so maybe you don't hear us. GoSick, I see you are here in the Zoom. Can you just unmute and start the video? That would be perfect. No. Okay, I guess we will make it without. Sorry, we're a little bit early in the program. That's maybe why you're not hearing us right now. But anyway, what I suggest is that I will start now a poll that you can see probably just below the Showcase platform on the Slido plugin. Sorry. And then you can vote for your best project. If you'd like to know more about GoSick, of course, you can visit the booth. Of course, I'm sure they will be here to answer your questions. So please do so now. We have approximately a 5-minute small short break. And during this break, I just invite you to book your meetings with the startup that you find the most, that you like the most and that you like to meet. So go back to the main whole reception, and then you can visit the startups from the Future of Health grant and book your meetings, and then you come back in the live session in 5 minutes for the next pitch from Tech for Eva and Fongit for this second batch. So we wait for you here. We can see also the pitches from you, the audience. Don't hesitate to vote. We will leave it open for 5 minutes so you can all participate. And in the meantime, if we have GoSig, that would be great. GoSig team, I'm not sure if you can
Yes,
hear
I'm
me.
here. I'm
oh,
here.
All right. Okay, perfect. Okay.
We are a little bit early.
Yes, that's why. That's what I expected. So sorry to take you at that time, but that's perfect. If you're ready, the floor is yours for a pitch.
Yes, give me 1 second and then
Sure.
I will be ready. All right. Good. So yeah, hi everyone.
Hello.
Thanks for waiting and your patience. So I'm Diego. I'm one of the 2 co-founders of. And yeah, I guess we all have heard about ADHD. In German, it's called ADHS. But did you know that 3 to 7% of all people are affected by it? So that's 1 out of 20. Now, people with ADHD, they struggle 10 times more than others when it comes to staying organized. So they have difficulties in structuring their day, are unable to prioritize their tasks, and they constantly forget their things. Now, so far, there are ADHD coaches, therapists, and medication trying to support people with ADHD, but none of them can assist them in their everyday life, which is when they would need it the most. And we are here to change that. We have developed a digital productivity assistant in the form of an app that helps people with ADHD to stay organized and manage their daily life. Now, we currently focus on parents of children with ADHD. And here we offer a scalable 4-week coach to teach parents and their children the structure and methods needed to tackle ADHD and to be organized. And after the initial coaching, they can use our app with the integrated methods to manage their daily life. Now, our key USP is that GoSig really takes its users by the hand and proactively assists them throughout the day, which is crucial for people with ADHD because they cannot manage their day on their own very easily. Now, we have already generated first revenue. We have established first partnerships with ADHD coaches, with chief doctors, and also schools. And another interesting fact for us is that parents are looking for help online. There's tons of active social media groups out there, and the term ADHS, which is German for ADHD, is searched up to 100,000 times per month in Switzerland, Germany, and Austria only. Now, we plan to exploit both these online and offline channels to serve 50 parents by the end of the year and 250 until summer 2020. And we are the best to pursue that. In our core team, with the founders, we have a background from ETH Zurich and HSG St. Gallen. So our founder team has the ideal complementary skill set in tech and business. And we just closed our second financing round of 750,000 Swiss francs together with new great investors, for example, Paul Sevinch, founder of Doodle, or also Nicole Herzog, founder of B2B. We are really excited for the next steps to come. And now if you have any in the ADHD space, you know any schools or companies that are open for collaborations or are interested even as a potential investor, please come visit us at the virtual booth and let's have a talk. Thank you very much.
Thank you very much,
and
Diego.
Thanks again for the patience.
No problem. It's our fault being too fast at the pitch. Okay, thank you. So again, if you would like to meet the founders, don't hesitate to go to the booth. It's like we really want to make it as physical as possible. Even if we are from different parts of Switzerland, even sometimes from other countries. So yeah, don't hesitate to visit them, talk to them. And in the meantime, we have about 6 minutes where we will leave you, and so you can book your meetings and discuss with the startups a little bit. And we start again in 6 minutes, so at 10:50, we start again with the second batch of the pitches. So thank you, and see you in 6 minutes.
Thank you.
A love like ours, lovers hard to find. How could we let it slip away? could we end it all this way? When tomorrow comes and we both regret the things we said today. Just want you to stay. A love like ours, love that's hard to find. How could we let it slip away? We've come too far to leave it all behind. How could we end it all this way? When tomorrow comes and we both regret the things we said today. Start spreading the news. I'm leaving today. I wanna be a part of it. New York, New York. These vagabond shoes are longing to stray right through the very heart of it. New York, New York. I wanna wake up in a city that doesn't sleep and find I'm king of the hill, top of the heap. These little town blues are melting away. I'll make a brand new start of it in old New York. If I can make it there, I'll make it anywhere. It's up to you, New York, New York. These vagabond shoes are longing to stray right through the very heart of it. New York, New York. I want to wake up in a city that never sleeps and find I'm a number one, top of the list, king of the hill. These little town blues are melting away. I'll make a brand.
Okay, I think it's time. So we will just start the second batch with the results of the votes from the first one. So as you probably have seen, it's Consulto who won with 35% vote. So congratulations to this team. And we will close this poll and we will move to the second batch for the pitch.
Hello, we'd like to welcome Aquafit. Thank you for joining us today.
Welcome to Aquafit Intimate. We are a startup. We are pioneering intimate wellness for women, self-care. We started 4 years ago, and self-care for vaginal health crosses all ages. Young women suffer from involuntary muscle contraction, and now that pornography has become the go-to standard for young men, experience painful intercourse at the beginning of their sex lives. The second group of women that we work with are women after giving childbirth, where it's not really told the estrogen story. Both childbirth itself is quite traumatic on vaginal muscles, but also estrogen levels go down during breastfeeding, which causes issues with intimate wellness and also psychological wellness, which you'll hear from Dana. And the third group of women, which is every healthy woman reaches menopause, and in her estrogen story, she is estrogen deplete. We are the first generation of women living 30 years of our lives without estrogen. We developed self-care because even if a woman expresses a problem with her intimate wellness, she will likely experience 3 years to getting a proper diagnosis. So to address that, we first started with a 3-minute conversational interface that allows a woman to self-assess herself, understand what she's suffering from, and also get medical help. The second thing we did is we took the 3 cornerstones of vaginal wellness, which are the vagina is a muscle, so you need to work with it. And it requires that we have a balanced pH, and also requires a little bit of helpful products to help us, like lubrication. And we developed the first patented intimate gel stick. It is literally what it sounds like, a gel in a stick. And what a woman needs to do is use it in the shower or work near her bed with a glass of water. And we've innovated something called intimate training, which basically is working the vaginal muscles. As you're working with this advanced hydrogel, you are also releasing and massaging active agents into the vaginal wall and balancing pH. We have 2 patents, one on the general hydrogel in the vagina, and the second, of course, in being able to deliver different active agents along this new all-natural vaginal self-care device. We started selling last year online. We've worked with over 2,000 women in our pilot in Israel. We were funded by the Israel Innovation Authority and the Case for Her that gave us amazing support to bring this to market. And we welcome conversations with anyone interested in improving how women feel and pain-free intimacy at our booth. Thank you so very much.
Great. Thank you so much for sharing, and congratulations on your patents and on your funding. The second startup that we would like to welcome is Hashiona. Hi, do you hear us okay?
Yes, I hear you guys. Thank you so much
you.
for having me. So, hello everyone. My name is Eva Gallant and I'm founder and CEO of Hashiona, the first all-in-one platform for Hashimoto and hypothyroidism patients to help them increase the quality of life and decrease the number of antibodies in the blood. So, do you know that according to American Thyroid Association, 1 out of 8 women has or will has thyroid disorder during their lifestyle? Whose we estimate there is more than 480 million patients globally. Those women may have up to 45 different symptoms, and the treatment here is very simple. It's just 1 single pill called levothyroxine. However, it does not work as it's supposed to do. More than 70% of patients on the levothyroxine still experience either all or some of the symptoms. This is because the underlying condition of autoimmune disorder, which is Hashimoto, in the blood. So that's why we created actually Hashiona. On the very beginning, we started with a deep research. We analyzed more than 1,200 medical articles from the PubMed But then we wrote the book basically and created our step-by-step gamificated remission program in our platform. And then on top of it, we created algorithms to even personalize this experience even more based on the patient preferences, based on the patient's blood test, surveys, and other factors. So now when the users are subscribing to the platform, they get blood test kits. They are sending to the doorsteps. They fill in some surveys, and based on the result, we prepare for them 6-month recovery plan, including meal plan, supplement, and other factors from the lifestyle batch. Hashiona so far raised more than $720,000, so we spent on building the platform, which is device agnostic, and reach out to more than 30,000 users globally. Currently, we also run the patient trials based on 100 Hashimoto patients, and we look for our seed round. We look for $2.5 million to kick off with a medical device certification, further personalization, and developing our machine learning algorithms and user acquisition. So if you would like to be interested to help millions of underserved Hashimoto patients, please meet us on the booth. Thank you.
Thank you so much. This is really exciting. And you can always find Hashiona's booth under Tech Forever section. We would like to welcome our third startup, Emma Health. Thank you for joining us.
Thank you. Can you hear me well?
Yes.
Thank you for having us. So I'm Dr. Nadia Prison. I'm Chief Medical Officer of EMA. At EMA, we create the first automated transvaginal ultrasound system for women to do their transvaginal scan from home. Our first vertical is IVF. The IVF patients are numerous. More than 50 million couples will need medical help to conceive. However, real life, cost, distance on the patient side, but also shortage of trained medical specialists and a complicated and overcrowded workflow all concur to only serve 1 to 2% of this population currently. With EMA, we bring a remote transvaginal ultrasound for women to do their ovarian stimulation monitoring from home. It is a system that combines a hardware and a software with image processing and AI, aiming at giving the patient easy access to IVF, lowering the cost, lowering the stress, increasing the revenue for the clinics. At the same time, we also bring better outcome. I just want you to remember that only 5% of oocyte will at some point give a live birth. 1 millimeter in difference in follicular growth, 1 hour difference before oocyte pickup, 1 milligram unit of hormone difference as a starting dose. All of those elements are impacting the IVF result. EMA can work on all of this. EMA can bring an easier workflow. EMA increase access to IVF. We are a team of doctors, engineers, and business savvy people. Please join us. We are now validating our proof of concept. We bootstrapped and raised a pre-seed of $200,000, and now we're looking for a seed round of $5 million. We'll be at the booth under Tech Forever. Thank you, and see you there.
Thank you so much. I also see that you're the Mass Challenge winner. Congratulations on that, and thank you for joining us today. Our next startup will be Dana.
Hello, you hear me?
Hello, yes. Thank you for joining.
Let's dive into the woman's health during pregnancy and early motherhood, something that can happen to you, your wife, daughter, or friend. 90% of all women experience some kind of mood disorder during motherhood, and 25% suffer severe mental health pathology. Unfortunately, 75% of all the cases go underdiagnosed, and our healthcare system can always help when needed. Perinatal mood disorders have a direct impact on the mother's health and our capacity to take care of the child, with potential long-term negative effects for both the mother and the baby. That's why we launched Dana in 2020. Dana is a digital health solution based on AI to improve the woman's mental health and well-being during motherhood, and a future digital therapeutic solution for the healthcare system. We launched Dana as a B2C2B model, an approach that has been proven with unicorns like Maven or Butterfly. First phase, B2C, focus on the users with a premium well-being app to generate data and reach a critical mass. Dana is tested in the market today with psychoeducational programs, a community of mothers, and a mood tracker with over 12,000 downloads. In parallel, we are starting our clinical studies with world-class hospitals to achieve the medical device certification class 2A, intended use, early screening of mood disorders and mental health pathologies, diagnosis support, and monitorization of patients for the healthcare system. Our IP is the Motherhood Vitality Index based on AI, which will allow a personalized approach for each woman during their mental, physical, and social transformation during motherhood. Veronica, our CEO, and myself have launched digital venture in the past and had the opportunity to lead international companies in different countries. Our motivation to develop Dana lies in our own personal suffering. Veronica tried several years to become a mother without success, and I, as a father of 3, was not fully able to support my wife during motherhood. We are a woman-led venture backed by a dedicated team of 12 full-time employees, most of them women, specialized in all disciplines you need to build a disruptive e-health and femtech solution. Dana starts in Spain, impacting 2 million women to prove the scalable business opportunity. Next step, expand to Germany and US with €1 billion revenue potential. We already have the confirmation from different international actors, such as the hospital in Mainz, that our solution is needed at different level. We raised €1 million in 3 rounds from APX, Ship2B Venture, the founder of Desigual, and dozens of business angels and 1 different state grants. We are opening a seed round of €1 million next year, part of it already secured, and are looking forward to meet investors willing to share our journey. The market potential is huge, and with your help, we can fight mood disorders and mental health pathology during motherhood to improve the life of millions of women, their children, and their families.
Thank you so much. Thank you for sharing and congratulations on your expansion. The next startup we would like to welcome is Muna.
Hi, everyone.
Welcome.
Thanks. So today I want to talk to you about sleep. We have an epidemic of lack of sleep. In the past 4 years, we've lost on average 1 hour of sleep per night, and it's affecting everyone. But in particular, temperature is a very important factor for sleep, as our body needs to cool down every night in order for us to fall asleep, maintain sleep. And in the morning is the opposite. We gain temperature to gain alertness. And in particular, temperature regulation issues are affecting 40% of adults, and women in menopause are particularly affected by that because 85% of them suffer from hot flashes and night sweats, which can ruin their night's sleep. And in general, sleep aids as a market is about $80 billion in spending and growing at a fast rate. And so that's why we've built, as our first product, the world's first smart cooling pillow pad, which relieves from hot flashes and night sweats by regulating the temperature in a smart way throughout the night, at the right temperature, at the right time, for the right person. The product is a smart device that goes next to the bed and a membrane that goes inside the pillowcase, which regulates the temperature under the head and neck in order to sleep better. And it works. We've published results at the World Sleep Congress this year on women in menopause in particular. By 10 nights of use, on average, is plus 35 minutes of sleep and plus 52% of sleep quality for them. That's huge. But since the beginning of the project, what we've developed is a real deep expertise on sleep improvement. We built a real expertise in making proactive technologies that improve sleep. We've raised 1.5 million euros so far, shipped our first product to thousands of users worldwide, 80% in the US and Canada and 15% in Europe. We've made over 1 million euro in revenue. And we've collected a huge database of over 3.5 million hours of sleep data, which allowed us to make unique AI around sleep recommendations. And our next steps are to launch Muna 2, which is our new next generation device and software product offering focused on women in menopause, made with sleep experts that help them improve their sleep night after night. And our vision is really to become a hybrid and continue on this consumer path and reinforce our medical strategy to become a reimbursed solution within 5 years. So contact me on LinkedIn or visit our booth if you have more questions. Thank you.
Thank you so much. Sleep indeed is very, very important. Don't hesitate to visit the booth at the Tech Forever section. Our next startup, which is also from Tech Forever, is Wild IA. Welcome.
Thank you.
Thank you.
Hi, everyone. My name is Sahana, a founding member and the head of product at Wild AI, a fitness app that helps active women train, fuel, and recover according to their female physiology. At Wild AI, we're taking a female-first approach because, breaking news, women are not men. There are important physical and psychological and physiological differences that need to be addressed to support women's health and well-being for the long term. Each woman goes through a lifetime full of changes, from their periods to going on birth control, through to menopause and beyond. But historically, this difference has been ignored, and it's been easier to create products just for one gender. Let me highlight a shocking stat. Only 6% of all sports science research is conducted exclusively in women. Yes, just 6%. As more women embrace fitness and sport as a part of their lives, we must provide them with the means to understand and look after their bodies. But for years, women have been following guidance for men. And as a result, women use apps and wearables that are made for men, which brings me to Wild AI. Wild AI is an app which helps you perform as a woman. You can choose to track specific symptoms and lifestyle variables that you typically experience. Second, you can pull in data from a number of fitness trackers or softwares, and then Wild calculates a readiness score in a female context based on these inputs. Wild then helps you train as a woman. We give you recommendations on what type of training you may be best suited to based on your physiology and your readiness level. We offer training plans created by coaching experts, which are truly adaptive to menstrual cycles. Second, nutrition. When you do your training, we'll tell you exactly what to eat and how much to eat based on your body weight and your life stage. Recovery. We don't believe that period pain is normal or that you can't perform at any stage of your cycle. If you've got a symptom, Wild also helps you recover by telling you how to mitigate these symptoms. We've created our technology with world-leading female exercise physiologist, Dr. Stacey Sims. Our team is made up of PhDs in AI and biomedical science, as well as Olympic-level coaches. Our product is a solution for active women, serving an unmet need due to decades of male bias in science and research. We believe in unlocking the true potential of the female body, and I'm excited to meet anyone who's interested in our product. Thank you so much.
Thank you so much. This is really exciting. Thank you so much for sharing.
Keep in mind that all these startups are from the Tech4Eva Accelerator, which is one of the first leading femtech accelerator. So there are startups from all around the world, and they also have an event today, later this afternoon. So if you'd like to discover, you can also meet at their booth and join the event later on.
Great, thank you. So our next startup would be Rue Medical.
Thank you. Hi, I'm Shreya. My team and I are working on a very large unmet clinical need that affects half of the world's population. I'm talking about menopause, a decline in reproductive hormones in a female's body as they age. Think of a woman in her mid-40s. She's going to suffer from hot flashes, the most common symptom of the menopause. It's a sudden sensation of intense heat in the body, causing sweating, flushing of skin, and affects her mood, sleep, self-confidence, and productivity. If we think about this woman as a member of the UK workforce, menopause has cost the economy 14 million working days so far. This inevitably also creates gender inequality in the workplace for women who are at the prime of their careers. We spent over a year validating and researching this problem. We've surveyed over 2,800 menopausal women, 175 GPs in the NHS, and spoke to more than 40 gynecologists around the world. And the results of our research have been published in world-leading medical journals. The results were unanimous. There is a crucial need for better management options for hot flashes. So we invented CoolZen, an over-the-counter, non-invasive, wearable medical device. Our device automatically detects the onset of a hot flash and triggers the body's natural cooling mechanism to bring relief. React, relief, repeat. That's how it works. Additionally, our mobile app helps women analyze and track their symptoms. Our algorithm allows for CoolZen to perform more efficiently by observing unique trends in the user's menopause journey. Of course, we have competition, but we are the first to personalize this process. CoolZen will also be the only medically certified solution for hot flashes in the world. Currently, we have a working benchtop prototype. Our company is ISO 13485 certified, and we're setting up a pilot study with the UK's largest employer. Globally, 1 billion women will be menopausal by 2025, and 80% of them will suffer from hot flashes. Out of our serviceable market, we will make an impact on more than 400,000 lives in the first year. Our team has biomedical engineering, medical, and commercial expertise. We also have an ever-growing clinical advisory team with British Menopause Society certified specialists. Our aim is not only to alleviate the effects of hot flashes, but to restore equality and confidence in menopausal women. So join us and help millions of women unpause their lives. Thank you.
Thank you so much for your presentation. Thank you for coming here today.
Let's move on to the second accelerator of this batch, which is Fongit. So we will have 4 startups from Fongit: Global Data Excellence, Diatheris, Global IM, and Endotelix Diagnostics. So the first one to pitch is Global Data Excellence. So whenever you're ready, the floor is yours.
Yes, I am ready. Can you hear me?
We hear you, but maybe a little bit too loud. So maybe...
Yes.
Okay.
Hello?
Yes, we hear you perfectly.
Yes. So I am Dr. Walid El Abed. I am the CEO and founder of Global Data Excellence, GDE for short. We created the first singular AI, ethical AI platform that enables the connection between people, systems, and data in natural language. So what are the problems actually that we are addressing is that people, they speak different languages, natural languages, and the natural language for humans is English, French, Arabic, Hebrew, etc., Spanish, Italian, etc. And the natural language for computers are Java, SQL, Python, C, C++, etc. So what we did actually is that we created a kernel, an artificial intelligence that is able to understand any language and to connect systems and people together so that you can do business management, governance, data governance, automated business management, and you can actually achieve your targets, putting your policies. Many presentations were around women here and women and gender equality, etc. So if you want to walk the talk, just plug DEMS Nexus, which is the name of our platform, and you will be able to achieve your goals. Put your policies in natural language, in French, English, put your targets, and the system will connect to all the data that is available, whatever it is, structured or unstructured, understand it, structure it, and make sense out of it, and will apply the policies of this data to understand if the data is deviating from the policies, and it will suggest, first of all, the impact and value of those policies on money and on people and on systems, and it will suggest solutions, and most importantly, it will enable you to create the economical and social platform so that you can actually address your objectives and create value. Thank you very much.
Thank you very much for your pitch. Let's move on to the next. Diatheris, whenever you're ready, the floor is yours.
Hi, my name is George. I'm a co-founder of Diatheris. It is a spin-off from University of Geneva with the goal of improving therapy and life for people with type 1 diabetes. So in type 1 diabetes, quantity and also quality of life is dramatically reduced. In fact, most type 1 diabetic patients are unable to lower properly glycemia and then to prevent the diabetes severe complication. So these patients are also at high risk of life-threatening events such as diabetic ketoacidosis and, importantly, hypoglycemia. This last has a side effect of insulin treatment itself, and alone can account for 10% of death, sadly, especially in children with type 1 diabetes. At Diatheris, we are developing a therapeutic approach, a new therapeutic approach for allowing a better glycemic control with less insulin, and at the same time overcoming both risk of diabetic ketoacidosis and hypoglycemia. So this is a strong, unique selling proposition over the current glucose-lowering adjuvants to insulin type 1 diabetes. which indeed have limited use in the clinic because the side effects are indeed hypoglycemia and diabetic ketoacidosis. So there is an unmet medical need for at least 10 million people globally, which represent a huge market opportunity for the therapies. So far, we have obtained a solid proof of concept data in the preclinical setting for efficacy and safety. And importantly, we got traction with several key opinion leaders in the diabetes field. So we are currently preparing for fundraising for the IND-enabling study next year. And in parallel, also, we are successfully building an innovative approach for discovering like new molecules for anti-diabetic approach. So the team started as an academic team, but now we are strengthening the theories with the biotech veterans and also clinical research experts. And of course, finally, so we most importantly are seeking now for looking for strategic partnership and investors who can join us in our mission, help us for developing this next generation therapeutic for type 1 diabetes. Welcome us joining in our stand, and thank you very much for your attention.
Thank you very much, Giorgio, for the presentation. Of course, keep in mind that you can also meet the founders on their booth. They will be here right after the pitch, but if you want to listen to them, we'll still have two in this batch, which is Global IM and Endotelix Diagnostics. So Global IM, are you already here with us?
Yes, I am.
Perfect. Then the floor is yours.
Hi, everyone. I'm Lance, co-founder and CEO of Global M. Right now, one thing is for sure. The demand for live content is skyrocketing for news, sports, and all types of media outlets. This past September, the world watched the funeral of Queen Elizabeth II. With 4 billion people tuning in, it was arguably the most watched live broadcast in history. BBC Studios chose Global M to provide SRT streaming services for the funeral to its rights holders around the world who specifically requested an alternative to satellite transmission. And sports federations and host broadcasters are now selecting Global M for distribution of live content as well. And here's why. Global M provides immediate cost reductions for broadcasters and sports federations while maintaining high quality, low latency solutions, replacing expensive satellite and fiber options with our patent pending technology. And we've just introduced new edge transcoding and re-multiplexing features with the help of technology from NVIDIA DeepStream. This new service allows for each edge node in the Global M network to transcode and re-multiplex with predefined settings for individual customers. Global M is an integrated software as a service solution. Our network scales automatically with increasing demand for point-to-point and point-to-multipoint transmissions. And real-time monitoring of all encoders and decoders in the network makes it far superior to satellite for contribution quality control and rights management. Our smartphone app activates hardware encoding in the handset, providing high-quality broadcast transmissions with direct connectivity over the Global M network. Very cost-effective for live transmissions for news, sports, and entertainment. We'd be happy to meet with you in our virtual booth today. Paul, our co-founder and CTO, and I will be there. Thank you very much.
Thank you for this presentation, and thank you for being here with us. Last but not least, we will get for this batch, we'll get you to vote for the best startup in your opinion. So stay there and meet the startup in their booth afterwards. So last but not least, we have Endotelix Diagnostics to pitch for the Fongit incubator. Floor is yours.
Thank you. Good morning, everybody. I'm Karen Bruns, CEO and co-founder of Endotelix Diagnostics. And what we do in Endotelix, basically, we're doing a diagnostic test for an autoimmune disease that probably most of you have never heard about it, that we call antiphospholipid syndrome. However, this disease affects 3 to 5% of the world population. And why is this disease is so current, but most of the people have never heard about it? Because the current diagnostic test is very insensitive. This test sensitivity is around 40%. That means it's like a toss a coin in the air. And it's where Endothelix make the difference, that our currently test sensitivity goes beyond 80%. That's make a game changing. And why it's important to diagnose the antiphospholipid syndrome? Because if a woman is positive for this disease and willing to be pregnant, there is more than 60% risk of miscarriages for the 2 first trimesters. And the other side, if a woman would like to have a birth control like pills, and you are positive for this disease, there is 90% risk of infertility after 10 years. That's why we develop a product in form of the point of care test. It will provide a accurate and rapid result for this disease before pregnancy or before taking hormonal pills. And in this way, for our B2B2C model in OBGYN, the market opportunity goes beyond 11 billion Swiss francs. And we hope by this will also to improve the life of millions of women. Thank you.
Thank you very much for this pitch. And now I just started the poll, so you can just now vote for your 3. I think you can vote for 3 startups, if I'm right. You can vote for 3 startups from this second batch. So either Aquafit, Hashionia, Ima Health, Dana, Muna, Wild AI, Rue Medical, Global Data Excellence, the other is Global M, and Endothelix Diagnostics. So feel free to vote. We will have a very short break this time because the startups pitch for the perfect timing. So we will just have the time for you to get a small coffee and to vote, of course, for one of the startups or 3 of the startups that just pitched. So don't hesitate to do it, and we see in 4 minutes at 11:26. See you.
You only stay with me in the morning. You only hold me when I sleep. I was meant to treat the water, but now I've gotten in too deep. For every piece of me that wants you, another piece backs away. You give me something that makes me scared, alright. This could be nothing, but I'm willing to give it a try. Please give me something, 'cause someday I might know my heart. You only waited up for hours just to spend a little time alone with me. And I can say I've never bought you flowers. I can't work out what they mean. I never thought that I loved someone that was someone else's dream. 'Cause you give me something that makes me scared, alright. This could be nothing, but I'm willing to give it a try. Please give me something
Okay, perfect. I think we will start again the pitches with the third batch of this day, the last but not least, with two different incubators and accelerators from Switzerland. The first one is La Forge. It's the tech incubator from EPFL Innovation Park. And the second one is the Tech for Trust Accelerator. So recently also set up in the region, I think 4 years ago. And so with a lot of success. Just before we pitch, I would like to say a huge congratulations for Wild AI, because they reached 43% of votes for the previous batch. So big congratulations of you. Of course, we don't have the audience to make a big round of applause, but if we would have been in physical, we would have done a huge round of applause for you. So congratulations. I will just close the poll for this second cohort. Then I invite Phenomex, that I see Colin here on Zoom, to present. They are alumni of the Tech for EVA, and now they are based at La Forge. So welcome, and floor is yours.
Hi, Johannes, and thank you so much for the introduction. So we are Phenomics Health, and we are a femtech precision nutrition for women company. So in 2030, there will be 1 billion women in perimenopause. And every year in the United States, 1 million women go into menopause. What happens is that 70% of the women have symptoms that are severe enough they impact their work and family life. And yet we have largely not talked about this. These topics have been taboo, and this really affects women's capacity to contribute to society. 75% of women will go to the doctor and return with no solutions. And this is partially because only 4% of R&D is invested in women's health. But more importantly, only about 0.002% of R&D is invested in midlife and aging women. So at Phenomics Health, we want to change this. When a woman goes into menopause, the average length of her journey is around 10 years, and she experiences around 34 possible different symptoms. And it is a highly personalized experience. And we feel this requires a highly personalized nutrition solution. So at Phenomics Health, our mission is to empower women to personalize their nutrition, to treat their hormone imbalances and health symptoms on their menopause journey. We use the latest in deep tech technology, focusing on privacy, security, and the user owning her own data. We also use minimally invasive biomarker testing. On the front end, we have a digital health platform. Think of it like the next step from the menstrual cycle app. So the women reach a certain point where the menstrual cycle apps no longer serve them. They aren't looking to attain fertility, but they are experiencing more and more symptoms that relate to their hormone levels. So when a woman no longer finds her menstrual cycle app helpful, she comes to the Phenomics Health app, and we continue with her along her life journey. My name is Colleen Fogarty Draper, and I've got two fantastic co-founders, Jerome Michaud and Michelle Coons. Thank you for your attention.
Thank you very much, Colleen, for the pitch, and see you soon. Next one is Auril Photonics from La Forge. Hi. Hello, Nathan. Can you hear me?
Hello. Yes, I hear you. Thank you. Okay, so I guess all of you have already taken some painkiller, some paracetamol or dafalgan as a drug powder, to put it into a glass of water, to mix it, and to drink it. It's a very common gesture, but it tells us about an important parameter for a drug. It must be soluble. If it's not soluble, it will have trouble penetrate into your body and will be inefficient. That's a huge waste, especially given that a drug takes 10 years to go to the market. And during the 10 years of research and development, the researchers in pharmaceuticals will measure solubility tens of thousands of times. The problem is that the methods they use to measure solubility are complex. They have a lot of steps that are slow, unreliable, expensive, or consume a lot of resources. So that's why an academic screening platform came to us to find a solution at Auril Photonics. We had more than 25 interviews with companies and laboratories. And from there, we developed what we call EASY. EASY, it's for easy assessment of solubility. It's a laboratory device that, thanks to an innovative laser technology, allows us to cut some steps in the measurement process. So it's much simpler to use and 30 times faster than the competition. But more importantly, it's a sustainable solution because it saves some electricity, consumables, and also up to 99% of chemicals compared to the competition. So it accelerates a lot the research by allowing the companies to save resources instead of wasting them in complex processes. So we sell the device to pharmaceutical companies and biotech companies at a price around 250k Swiss franc. The target currently is Switzerland and Europe in a broad sense, and we target specifically SMEs. Right now, that's a market around 50 million Swiss franc. The device is currently tested by customers. We plan to have first sale by the end of next year and up to 30 sales in 2026. And we are currently fundraising 1 million Swiss franc. So if you're interested, you can also contact us for that later. So we are Aurel Photonics for experts in lasers, prototyping, and software. And we leverage also the network of our advisors and solubility and pharmaceutical fields. We are Aurel Photonics, and if you have to remember one thing, we solve the insoluble.
Thank you. Right on time for the pitching. Congratulations, Nathan. Also, of course, you feel free to join the virtual booth if you want to, as a visitors, if you want to meet them. They are here to answer your questions and go more into the details of the tech and the business plan and everything. So they'll be happy to answer all of your questions. Let's move on to the next one from Laforge, which is Clear Sky. Hugo, can you hear me?
Yes.
Perfect. Then the floor is yours.
Thank you very much. So we are Clear Sky. We are a spin-off of EPFL based at Laforge, and we are building the next generation of AI assistants through privacy by design. And indeed, we had this vision that if we want to reach the next step in terms of assistance to mobile user, we're going to need to know them so well at some point that full privacy by design has to be ensured. And this is where tech giants are seeing roadblocks at the moment. So we as a startup, we have the opportunity to build a more virtuous system since day one. So our mission is to build private, personalized, and proactive apps around all the data we generate on mobile, voice, text, motion, healthcare, you name it, and to put it back at the exclusive service of the user. So this is possible thanks to edge AI technology, which means that you bring the AI engine on the device directly. You don't need to send anything to cloud services anymore. And this allows many things, including personalization for your usage. So it works at your exclusive service. At the same time, you reduce the digital carbon footprint because it's a low power device and you're fully aligned with existing and upcoming data regulation, of course. The first use case we address is actually specifically working on voice data. And we address the problem of augmenting data of private conversation with AI in a business setting. So we are all attending meetings every day. So would it be on the phone or via Zoom or whatsoever? And it generates a lot of downstream tasks, of course, as we know. So it results often in lost item, inefficiencies, and wasted time in an era where we need actually to work smarter and not harder. So of course, AI can help, but we don't want to compromise on confidentiality, especially, for instance, if you're in a board meeting, for instance. So our first application is named Call Edge and is actually a meeting assistant that is running fully on your device, sorry. So an Edge AI assistant, which processes your voice conversations on the fly. So it extracts automatically insights from your conversations and turn actually meeting mentions, deliverables, for instance, into actions. So by one tap of the screen, you'll be able to pre-fill an email, for instance, or set a schedule. So thank you very much. We are Clear Sky.
Thank you very much, Hugo. I've been biased on this one, but the technology is stunning. We have been doing some tests with some workshops that we organized, and yeah, this is working very well. So don't hesitate to visit their booth. Next one is, I think it's SpireCut. Sorry, I missed my notes. SpireCut. Clémence, floor is yours whenever you're ready.
Hi, everyone. Can you hear me well?
Yes.
So my name is Clemens Herman, and I'm in charge of business development for Spacet. We are an award-winning Swiss medtech startup specializing in hand surgery. Spacet's technique and patented instruments are a breakthrough for hand surgery. It's an ultrasound-guided surgery for the two most common hand conditions, carpal tunnel syndrome and trigger finger. It will happen to 1 out of 7 people in their lifetimes, so it's very likely that several of us in the room will be impacted by those surgeries. For hand surgeons, they are the most common hand surgeries. With our single-use instruments, surgeons can operate without incision or resulting scars. I repeat, they can operate without any skin incision or resulting scars. Patients can then return to their daily life without dressing on the operated area. We have a proof of concept with more than 900 patients at this point that have been operated without complication. Spacet owns all the patents and we are already FDA listed. We're currently finishing the clinical investigation in Europe. It's currently taking place in Brussels, and we have recruited all the patients, which means that we expect the CE mark in the spring of 2023. This is a breakthrough for surgery without resulting scar or skin incision. And we hope you can join us on this journey. We're currently raising 2 million in 2023, and the majority of our previous investors were smart money investors. So they really understand the business case and the technical aspect of the surgery, but we're obviously open to investors with different expertise. Thank you for listening, and don't hesitate to come talk to us. I will now share the link tree to more links about the company.
Thank you very much, Clemence, for the presentation. Yeah, I hope I will, if I need some surgery on my hand, I will get your technology soon, of course. Let's move on to the next startups, which is Voltiris.
Yes, hi everyone. So I'm Jonas, can you hear me?
Yes.
Hi, Jonas.
Okay, that's good. So in a nutshell, at Voltiris, we develop photovoltaic modules for agriculture and more specifically for greenhouse growers. So 40% of the greenhouse growers are going to hold their operation next year due to the high energetic costs. And this means that growers are actively looking for some energetic solutions to lower their energetic dependence on fossil fuels, such as solar panels. But one of the main problems that they meet is the space. So they cannot put solar modules on top of their greenhouse, as this will lower the radiation inside of the greenhouse, or they don't have the space to put them around. So at Voltiris, we offer them the ability to leverage the large scale of their greenhouses to generate their own electricity. So this means 3 things for them. It means that we decrease their energetic dependence, that we lower their energetic costs, and that we improve their sustainability. So we do this thanks to color-optimized solar modules. So these are solar modules that filter sunlight such that the light colors needed by the plants reach the plants. And with all the rest of the colors, the rest of the spectrum, we generate electricity. So we install our modules inside of the greenhouse, and we offer the growers energy as a service, which means that we become the energy providers of the growers. So currently, over the previous month, we could close our pre-seed financing round, and we could get some agronomical results. So we could show that our modules don't have an impact on the plant's growth, for instance, for tomatoes. But this was a small-scale study. So in the coming month, we will validate these results on some larger scale agronomical study in the Netherlands. And we also do larger scale pilots with commercial growers in Switzerland and in the Netherlands that are really key to our commercial activization and to our go-to-market. So now you could support us different ways. So you can support us either, for instance, financially by helping us for a seed round that will be taking place next year, or you can help us introducing us to some partners of the ecosystem, for instance, for pilots, and you can also take part in our development. So I would like to thank you for your attention, and you can join me on my booth if you have more questions.
Yeah. Thank you so much. The technology is actually really impressive, and it's really hard to imagine it from a short pitch, so make sure to visit the booth to find out more and to see it with your own eyes.
Thanks.
Let's move on to Meanwave, another startup from Laforge.
Hello, everyone.
Hello.
I'm Mustafa. Hi, how are you?
Good, thank you. Your floor is yours if you want to pitch your startup.
Sure. So I'm Mustafa Khosrow, and I'm delighted to present Meanwave today. We are rethinking the bolts and nuts of wireless communication systems at Meanwave by introducing patented antennas and filters that are 10 times smaller, lighter, and more energy efficient than the existing alternatives. To better understand the value of our work, let's start with fundamentals. There are two methods to transfer data. Either the data is transferred through a wire or fiber, or what we do care about at Meanwave, the wireless method, where the data is transferred through air and waves. Among many applications of Meanwave tech in wireless communication systems, we focused on two. The first one is 5G cellular communication. 5G communications will be eating about 1% of the total energy production of the world. At Meanwave, we are building filters for 5G base stations to make them 30% more energy efficient and 50% cheaper to produce. The second vertical, and perhaps more exciting, is the wireless communication in space. Wireless communication in space provides internet over satellite that will play an important role in providing broadband connections everywhere in the world. Here, we are developing filters that are 10 times smaller and lighter than alternatives with similar quality. This is important because each kilogram that you send to the space can cost you about $100,000 in mission cost, and we can reduce tens of kilograms of the satellite weight using our technology. Now imagine that the communication constellations like Starlink have over 10,000 satellites, and Meanwave is reducing the cost of these constellations in the order of billions of dollars. We have started 18 months ago as a spin-off of EPFL, and currently we have customers both in space and terrestrial applications. We were able to assemble a great team as well that cumulatively have more than 200 publications, 15 patents, and 30 years of industrial experience in wireless communication that makes us ready to swiftly go forward. We are currently raising 1.3 million for our seed round aimed at Q3 2023. So let's hope for 10 times better communication systems. Thanks.
Thank you very much for this presentation. Next one is Captis, CO2 capturing for trucks.
Yes. Hi, everyone.
Hello.
I don't know, you tell me when I start. I hope you're doing well.
You can start right away, right now.
Okay, perfect. So I'm Theo, co-founder at Captis. So Captis is a spin-off from EPFL with helping corporates and also transporters to drastically reduce their carbon emission in a cost-effective way with carbon capture. So compared to all other carbon capture technologies, our main differentiation is that our technology is compatible with EV vehicles. But before speaking about the tech, let's talk about the why. Why are we building this device? So first, we found out that heavy-duty vehicles are huge contributors to climate change, around 10% of our global carbon footprint. And secondly, because this sector is very far from achieving its climate targets. The reason behind is simple: electric and hydrogen, current low carbon emission, require to replace each truck by a new and expensive one. And transporters cannot afford it. And secondly, because the technological change is not only on the vehicle itself, but also on the whole infrastructure behind. So a completely new infrastructure has to be built, from the production of the new energy source to its distribution and storage, changing the whole supply chain. So that's why we think there is a potential for retrofitting solution to bridge this timing gap. So our patented and retrofit solution has two main advantages. It is low cost, as we are using the same vehicle and we decarbonize it. And it is also fast to deploy, as we are using the existing infrastructure. So how does it work? That we connect our system to the truck exhaust pipes between the cabin and the trailer. And the first step is that we are recovering the heat from the exhaust, and we use it as a source of energy to capture the CO2 molecule. Up to 90% of the CO2 molecule is in the stream. Once the CO2 molecule are captured, they are compressed until it reaches the liquid form to be stored on board. And then we sell the liquid CO2, because today liquid CO2 has a value on the market. So in terms of traction, We have already 2 early customers, including 1 leading multinational in the agricultural machineries. We have signed some letter of intent with potential CO2 buyers, and now we are building our first full-scale prototype. So we also started our pre-seed. We got our first $1 million committed by some VCs, business angel, and 1 big corporate, and we are looking for additional 500K. So we are more than happy to speak with you in our virtual booth between 12 and 12:30. Thanks a lot.
Great, thank you so much. And just a reminder that these startups were from Laforge, and if you'd like to visit them or talk to the founders or ask more questions, discover more, don't hesitate to find them on the platform under Laforge section. Our next startups will be from Tech for Trust. And our first one is Athena. Welcome, thank you for joining us.
Hi, everybody.
Whenever you're ready.
Can you hear me?
Yes.
Okay, super. Hi, when was the last time you took a food supplement or a medicine? Was it fake or authentic? And how do you really know? Fake goods create losses of more than $300 billion every year. They impact companies and society in many different ways, and they endanger human lives. In fact, it is estimated that almost 1 million deaths a year are caused by fake medicine or fake food. Unfortunately, traditional authenticity solutions based on any visual element have not worked, as counterfeit has increased exponentially in the last years. Hi, I'm Matteo, the CEO of Autena, and in Autena we are changing this. We have combined Internet of Things and blockchain in our authenticity and traceability as a service platform that is disrupting at the same time anti-counterfeiting and traceability market, and for which we have filed already 11 international patents. First, we have created Autena Shield, which is a physical digital seal that protects the identity of a single product, and it is the strongest protection against product dilution and fraudulent refilling. A consumer can check a product authenticity with the tap of a smartphone without any app. We have protected goods that are already in 75 countries, in food, pharma, in perfume, and other luxury markets. Second, we have extended our protection by creating the world's smallest rechargeable tracker that at the level of a single SKU can monitor a location in 185 countries and can monitor also temperature, humidity, rough handling, and much, much more, ensuring unprecedented cold chain protection anytime, anywhere, and at the level of a single product unit. This is just phenomenal, and we are integrated with one of the largest pharma companies in the world. And there is more. We have been awarded from InnoSwiss a 1 million grant to upgrade even further our solution with ETA and ZHAV. Third, as many luxury products are now becoming not only physical, but also physical and digital at the same time, we have created the world's most secure link between a physical product and its digital twin. We have launched this last year, and we have already integrated with 10 customers worldwide. We are growing 300% every year, and we started our Series A. So if you work in a company that is looking for the ultimate traceability solution, feel free to reach out. If you're an investor looking for a still early round in a company with the ambition to IPO within five years, you can reach out, but you need to be fast in this case. We are Autena. We are making the world a more connected, transparent, and authentic place. Thank you very much.
Thank you, Matteo. Thank you so much for sharing this. Our next startup from Tech for Trust is Boxy HQ. Hi, welcome.
Thank you. Just double checking everything's okay.
Should be all fine whenever you're ready.
Lovely. Hi, everyone. I'm Deepak Prabhakara, co-founder and CEO at Boxy HQ, where our mission is to make developer security simple. We've all heard about cybersecurity attacks now, but it's estimated that cybercrimes will cost around $10 trillion by 2025. And 70% of development teams, they're frequently skipping security steps due to immense time pressures to complete projects. And what this has meant is it's, of course, given attackers on the other side a lot more opportunity, a lot more surface area to attack companies of all sizes, all the way from startups to the much larger enterprises. So on one hand, it's not just the security professionals who are under pressure, but of course developers, because we're seeing the shift left trend happening with security, where you build a product, you're best positioned to kind of plug in security. But unfortunately, the reality is that there's not enough time or even resources to make this happen, especially as a startup. So our mission involves building commercial open source tools that provide very simple plug and play APIs for security, compliance, and privacy. Today, the reality is that regardless of all the layers of cybersecurity you add on top, you will eventually get breached. And we're shifting the paradigm to start thinking about how do you now make your internal systems secure. So towards this sort of paradigm shift, we're offering tools like enterprise single sign-on, so authentication, your first layer of protection, audit logs, and then a privacy vault sort of structured around GDPR and data regulations. We're an agile team of 5. We started in August last year and raised a $2.5 million round in October last year. So come along to our booth, find out more, especially, given all the startups here, you don't want to be thinking about security. You want to be spending more and more of your time on your core proposition, your core product. Ultimately, we as startups are here to change the world, so we should go back to doing that first. Thank you, everyone.
Thank you so much. Thank you for joining us today. Our next Text for Trust startup will be Atmosec.
Hi, can you guys hear me?
Hi, all great. You can start wherever you like.
Perfect. So hi, everyone. My name is Andreas Gelman. I'm the co-founder and CEO of Atmosec. We're a holistic SaaS security company. Basically, in today's day and age, it's gotten a lot easier for organizations and mostly employees inside the organization to use, connect, leverage, and use SaaS services. Basically, it's not more than a few clicks of a button. But what we don't usually think about is, as easy as it is for an employee to use a new SaaS service, they're basically sharing a lot of important company information with third-party providers without necessarily talking to IT and security. When was the last time when one of your employees installed Grammarly, he thought of the fact that they're sharing all their external emails with a third-party company? Basically, that's where Atmosec comes in. We help organizations understand everything that is connected into their SaaS ecosystem. What are all the employees using? What permissions do they have? What data might they be sharing with these third-party providers? We also help them understand how they can improve their security posture and reduce their attack surface so that the chances of an attack are reduced substantially. And third, we have a unique technology to actually help identify and stop attacks as they happen in this SaaS ecosystem. If you're interested in understanding your SaaS environment more, want to get a free SaaS assessment, or basically just interested in the security space, either as a customer or as an investor, feel free to reach out to us at our booth or through our website. More than happy to chat.
Thank you so much for sharing with us today. And to anyone who is interested to finding out more and to hearing more and to speaking with a co-founder, don't hesitate to find them at the booth today or for the next couple of days. Let's welcome our next startup. Hi, welcome. Do you hear us okay?
Yeah, it's okay.
Perfect.
Thank you very much.
The floor is yours.
Yes. So imagine that you are the co-founder of a mid-sized cybersecurity company. It's a Sunday afternoon at the beginning of April, 9 months ago. It's a sunny day and you are gardening because you need to de-stress. But you can't help thinking about your business because you are worried. With the COVID crisis, most of your customers have accelerated their cloud migration. and it has very concrete consequences on your traditional business. You sell less integration services, your historical maintenance activity is going down, and your current reselling discounts are half of what they used to be. How to survive such a violent move? You already know the answer. You need to accelerate your managed service activity. Within a managed service, you operate cyber technologies for your customers, which is exactly what most of them are expecting because cybersecurity is becoming too complex and requires too much time. But accelerating this managed service activity is not that simple. You need to analyze a massive amount of data coming from multiple technologies deployed in multiple customer contexts. What if you could analyze that data automatically and simplify the work of your teams? What if you could use also that data to communicate much more proactively with your customers about the quality of service you are delivering on a day-to-day basis? What if you could use also that data to innovate and offer new generation services like automated audits or like the unified cybersecurity cockpits that so many companies are looking for? This story is a real one, and the company is eSecure. With our affordable data platform and in only a few months period, they could get a 100% productivity gain on their managed service operations. And they are now offering new generation services powered by Alchemia. This is what we do at Alchemia. We transform IT SMEs into the smart managed service providers that you and the market needs. Thank you.
Thank you so much for sharing with us today. And for anyone, if you'd like to find out more, again, don't hesitate to find Alchemia at the Tech for Trust section in the startups. And last but not least, we have Snowpack.
Hi, sorry for the voice. I'm a bit sick, so I apologize.
No worries. Thank you for coming. The floor is yours whenever you're ready.
Okay, so today's cybersecurity paradigm is the chain of trust. But if you think about it, the chain of trust first makes you dependent, and second, it's a bit like a house of cards. One vulnerability is enough for the whole chain to collapse. And so we in Snowpack, we're making users, devices, and data invisible. So in order to complete this chain of trust, so that even if there's one vulnerability, no hacker can exploit it and get to users' data. So I'm Frédéric, co-founder and CEO of Snowpack, Become Invisible. We are a young spin-off from the French Atomic Energy Commission. We are 11, and although our technology is very young and disruptive, we have gained some recognition by the French government and the French cyber industry lately. So how we do making people and users' data invisible, we are deploying and operating an overlay network, which we call SNO, which has unique properties, no trusted third-party anonymization, no trusted third-party security. In fact, man-in-the-middle attack are impossible on our network, and we are hiding our users' attack surface. So out of this SNO, we provide various plans for various use cases. Whether you are an individual who wants to bypass the geo-blocking, a pen tester who wants to leverage our infrastructure in order to make a parallel test toward your own infrastructure, government agencies or other experts who want to real anonymization in order to gather intelligence, whether from a clear, deep, or dark nets, or an editor, especially if you are a cybersecurity editor, who wants to embed its the unique SNO properties into its own application, whether these applications are point-to-point or point-to-multi-point. Just as a few examples, for example, we're developing with a partner a sovereign DNS solution. With a bank, a French bank, we are enabling banks to exchange data about fraud, money laundering, terrorist financing, while complying to GDPR, bank secrecy, and without any risk on their own competitiveness. And with cyber threat intelligence, we enabling whole industry to exchange data on attacks without any reputational risk. So if you have any use case where invisibility could be useful for you, but feel free to come in our booth and I'll be happy to talk with you. Thank you.
Thank you very much, Frederic, for this presentation, despite your health conditions. Thank you. It's been a pleasure. We have heard 33 startups today. So I just launched the vote for the third batch of the pitches. So don't hesitate to do it now. We have a few minutes to do it. Now I would like to give the floor to a person that is very important for us at the EPFL Innovation Park. And I want to invite Tom Rosenfield of the Rosenfield Foundation to share with us how his foundation supports innovators around the world and here in Switzerland as well. And he will also give us the winner of the prize that we usually give during this type of event. So Tom, happy to see you. Great to see you.
Thank you very much.
And the floor is yours.
Thank you very much, Johannes. Appreciate very much, and I appreciate very much working with the Innovation Park, with La Forge, with Tech for Trust, with all the engineers and technicians in the Swiss Romande and in Lausanne. The Herbert and Audrey Rosenfield Fund Incorporated has been set up to reward, in a very small way, but reward without any strings, innovators. That could be scholars, that could be students, that could be projects, that could be companies who are really interested and oriented toward doing social good. And that's where we are. We've given to the EPFL groupings, we've given already 12 prizes over the last couple of years. We have another very large presence in New York City, my sister. And we finance a community college there for students in a community college, which is extremely well, we have a great relationship with them as well. Today's winner, which I'm very happy to say, is Nuria. It's a company which has a very innovative, I would say, behavior modification system for currently oriented toward helping people avoid foods that might not be good for them. Could be either through diet or through diabetes. And I had a long talk with Lucas and Hugo this morning, and this company, and they are a company, they are an SARL, was proposed by the Innovation Park, and I think they're very worthy recipients of the Rosenfield Prize this year. So thank you very much, and we look forward to meeting them and understanding a little bit more what they do later. But they're really a great innovative company. Thank you.
Thank you very much, Tom, for this. Thank you very much, Tom, for this support and for this prize to Nuria. I don't know if you remember Nuria. Thank you, Tom, because they were actually the first one to pitch at the very beginning of this morning session. So I don't know if you were awake at this time. But anyway, thank you, Tom, and congratulations to Nuria. And also now we have also a winner for the pitching and for the third batch, which is Alchemia, actually, with more than 50% of the votes, so that's huge again. So congratulations for you, Alchemia, for this pitch. Of course, there is nobody in the room, so we cannot really make a big round of applause, but you have all our congrats. All right, I will stop that. And yeah, so now this event comes to an end. And it's now time for you to visit the booth again for a few minutes. You will find all the content material. You will find all the content material that you can also download. You can watch videos, but most importantly, you can chat with the founders. They are here now. They are not here tomorrow. The booth will stay tomorrow, but the founders are here now. So chat with them and discover the innovative solution.
Yep, and the platform will be live for the next 3 months, actually. So if ever you change your mind about being interested in one of the startups, you can always go back and visit their website and see the materials and see all the content that they provided. I wanted to say a big thank you to the startups who participated in today's pitch, and thank you so much for joining and sharing your innovative ideas with us. And I also wanted to add a big thank you to Robinson and Mike, who set up this 3D platform and who made this virtual platform a reality to us. Thank you to the tech team, and thank you to the smaller team, and see you later.
See you later. Don't hesitate also to share this platform now. It's really a platform where we can also meet all the entrepreneurs from Switzerland. So don't hesitate if you met an interesting startup or if you find the concept interesting to share it on LinkedIn or to your contacts, and so that we can also talk more about our startups and other programs that are here only to support startup and the innovation here in Switzerland. So thank you everyone, and see you next year for the next event.
Enjoy your visit.
Sometimes you're better off dead. There's a gun in your hand and it's pointing at your head. You think you're mad, too unstable, kicking chairs and knocking down tables in a restaurant in a western town. Call the police, there's a madman around, running down underground to a dive bar in a western town. In a western town, a dead end world. The eastern boys and